Hi, I'm Nancy Way, a physician here at Massachusetts General Hospital, and I'm here today with Debbie Burke, our Senior Vice President for Patient Care Services and Chief Nurse. So Debbie, can you tell me a little bit about ballot question 1?
So ballot question 1, if passed, would impose mandated staffing ratios at all hospitals in Massachusetts. And what's important to understand is that those same ratios would be at a place like Mass General, where we take care of some very sick patients, and the same ratios would be imposed in our community hospitals.
And what do you think the impact would be to us here at this hospital?
So the biggest thing that worries me is that staffing decisions are really based on the professional judgment of our nurses. They look at the patient, how sick they are, also the experience and skill set of the nurse, and then they make appropriate assignments based on that. But mandated ratios would really be a one-size-fits-all. So it would be mandated ratios at all times, at all hospitals, regardless of how ill the patients are.
And I know for myself as a physician, I really value our bedside nurses' ability to make these decisions, and they do such a great job taking into consideration patient safety and the care of their patients. So the other thing I've heard about is that the ratios could impact access to care.
So as I mentioned, we'll need to meet those patient ratios at all times. So what happens when we don't have the correct ratios in place? I'm worried that this will impact access to care. So for example, particularly in places like our emergency room, what happens when we have an influx of patients that need care and we don't have the number of nurses that are required? But this could happen in any area. What about a mom who comes in to deliver a baby and we're not meeting the ratios? And then there's another area that I'm very worried about, and that's behavioral health.
Yes.
It's estimated that the state of Massachusetts could close up to 1,000 beds in Massachusetts because we won't have enough psychiatric prepared nurses to care for those patients.
And that's already an area that we already have a bed crunch to begin with.
Absolutely.
All right. And then in terms of costs, can you tell us about what this would potentially cost our healthcare systems?
So at Mass General alone, we expect that it will cost us about $34 million a year. And the Health Policy Commission actually had a study done a couple of weeks ago, and they estimate upwards of $900 million a year cost in the state of Massachusetts for this bill alone. And even though cost is certainly a concern of mine, as we said, really the other two issues are a bigger concern. Taking away the decision-making of our clinical nurses who are at the bedside, and also patient access. So I would encourage all of you to please get as informed as possible about ballot question 1 so that you can make an informed decision. But I can tell you that I'm voting no on question 1.